The birth of baby is always a joy. A newborn child is pure, full of promise and hope. But with this hope comes uncertainty for the future. All parents worry about their child's well-being. But what medical insurance can families turn to safeguard their child's health?
Cord blood banking is the collection and storing of blood taken from the umbilical cord after the child had been delivered. Cord blood is unique because it contains large numbers of stem cells and is one of the richest sources of stem cells in the body.
A baby's birth provides a once-in-a-lifetime chance to collect and freeze unique cord blood stem cells for current and future medical use. Stem cell research has reached new peaks in the world of science and technology today. They have a unique ability and can be programmed to become adult red and white blood cells, liver, kidney and even bone cells.
Storing your child's stem cells is like a form of biological insurance. Just in case the child develops some blood disorder or cancer that requires a stem cell transplant, having these stem cells stored away will increase the treatment options for the child. And in some patients, this may represent the only curative treatment option. So in a way, it's like planning for the future, just like insurance.
We decided to go to cord blood banking because we know the benefits of cord blood banking. It's like an insurance, sense of security for Tristan. Know that as times like this, sometimes a person can get into cancer and stuff. So in a way, cord blood actually, as technology goes by, we know that cord blood can actually help in saving lives and also saving our baby's life.
Cord blood is collected after the baby is delivered and the umbilical cord clamped and cut. There are two techniques to collecting cord blood: the needle and syringe technique and the bag technique. In the needle and syringe technique, the syringe is first filled with an anticoagulant before it is inserted into the cord. As much as 150 to 200 cc of blood is extracted. The bag method is similar. A needle is inserted into the cord and gravity is used to draw the cord blood into the collection bag.
The procedure was very fast. It was like within a minute, the doctor just had to insert the syringe into the umbilical cord and then draw the blood, and it goes into the bag, and that's it.
After collection and transportation to the laboratory, the cord blood is verified with the attached collection form filled in by its clients. A pre-processing sample is obtained to determine the blood type and cell count of the child. The blood bag is then centrifuged. It is spun to separate the cord blood into its red blood cell layer, white blood cell layer, and plasma layer. It is the white blood cell layer that is extracted because it contains the largest quantity of stem cells. The stem cells are then placed in special cryovials which can withstand the extremely low temperature of storage. Once they are frozen to the optimal temperature of -180 degrees Celsius, they are kept in cryo-storage tanks. When needed, the stem cells can be thawed immediately and be ready for use in a matter of hours.
Anyone can store the child's cord blood, unless there are complications during the delivery process. But it will be particularly useful for families who have cancers, for small-sized families, for single-child families, for couples who have difficulty in conceiving. It is also very useful for couples who are of mixed ethnic groups or from minority races, because in these groups of people, it will be very difficult to get a public donor from the public banks because of the difficulty in matching.
Around 30,000 people each year are diagnosed with conditions treatable with a bone marrow transplant, but only about 25% of these patients have a relative who is an appropriate tissue match. With banked stem cells from one's cord blood readily available, patients with severe conditions need not wait anymore before seeking treatment. Banking a baby's cord blood could someday even help a family member.
That's because in cord blood transplants, we do not need a perfect match. So that means it can be used for other family members where there is some match, though not a perfect match.
Actually, we are recommended to many friends, and we know that the benefits of cord blood, although it's a price, but I think it's a small price to pay for future insurance, especially for our baby.